Opioid addiction is a national public health crisis that affects individuals and families regardless of their age, race, or income. The statistics are overwhelming. More than 130 people die from opioid addiction every day. But there is hope. Recovery is possible. The information contained in this podcast is solely for informational purposes and should not replace advice from a medical provider when making healthcare decisions. This podcast contains opinionated content and may not reflect the opinions of any organizations this podcast is affiliated with. Nothing discussed in this podcast shall constitute or should be construed as endorsement by the Independence Blue Cross Foundation or Independence Blue Cross, LLC, of any product or service discussed herein. We will discuss opioid use and opioid treatment, which may be triggering for some listeners. Listener discretion is advised. In Season 3, we've been exploring the meaning of inclusive recovery. And today, on Someone You Know, we're joined by Chris Molaro, the CEO of NeuroFlow. NeuroFlow is a digital behavioral health platform that delivers mental health support while tracking and assessing progress through the app. Chris is a graduate of West Point and the University of Pennsylvania and served in the Army for 5 years, including a tour in Iraq as a platoon leader. On this episode, we discuss the ways technology and data can help with access to care, how access to care is not binary and recovery is not linear, removing the barriers to the access of information, the importance of all behavioral health resources creating a united front and working together, and why they call NeuroFlow the Netflix for mental health. Today, NeuroFlow is helping 15 million Americans across the country, providing the tools to those who need it, where they are at, in pursuit to create the most engaging digital mental health experience. I'm your host, Heather Major, and this is Someone You Know. As we are, dive into the conversation about NeuroFlow, but I think everyone needs to hear a little bit more about Chris Molaro if you're comfortable.
Sure.
How did it come to be? How did you and how did NeuroFlow come to be?
Well, it depends. How long do we have?
Yeah.
We could go
as much time as we need.
So it's kind of interesting, in hindsight, looking back on it, I think the story starts back in Iraq 13 years ago. I was deployed. I was in the Army, and I was a platoon leader, which was an insane job to have as a 22-year-old, and but an honor and a learning experience, all the above. We had 280 combat missions doing counter IED, which is improvised explosive device, counter IDF, which is indirect fire, so like rockets and so forth. Mitigating those risks against us and the Iraqi allies. After 12 months, that's a highly stressful environment where you're on all the time. And all of us, I would say, had some sort of sleep issues or nightmares, or, you're just, when we came back home to Texas, we, they called it being reintegrated into society. It's like, okay, you were in a combat zone 24/7, 365, and now you have to drive on a regular highway and not be concerned about like bombs. And that's, that was just a challenging reintegration. And some people handle it better than others, and no fault to their own. Like we didn't, it was, especially if, I had it easy because I didn't have a family at the time. So it was like, I just had to be concerned with myself. And I couldn't imagine coming back home where then I had kids at the house and a spouse to care for. And so anyway, make a long story short, we had a soldier that was being treated for some physical injuries, raised his hand, said, look, I need some extra support. I'm not sleeping well. I'm not rested. So he was given a sleep medication, antidepressants, was given a referral to therapy. This is a really good news story because you have, on a military base, all costs are covered, but access isn't an issue. And he raised his hand. He's pretty brave in my book. 3 months goes by, and we tragically lost him when he completed suicide and took his own life. And, in hindsight, we learned that he never actually went to the therapy appointment. He never went to the pharmacy to get his medication. And no one ever followed up with him to check in. Hey, how are you doing? Is this working, not working? What could we do to improve that? And, the reason I say in hindsight, that's the starting point of NeuroFlow is because it wasn't the next day that I had this idea. It was a number of years later when I was in Philadelphia at the Wharton School, University of Pennsylvania, where I was taking a business class in healthcare that was taught by a psychiatry professor. And we were learning about these new business models, something called mental health parity. And I have an engineering degree, so I'm thinking, like, wow, why isn't everybody doing this? And this meaning integration of mental health services across our communities and so forth. And the answer came back a few things. 1, cost; 2, access; 3, just availability of the professionals. And that's where we thought technology can help bridge that gap, not be the end all be all. And that was 7 years ago. And, as they say, the rest is history.
Yeah, the rest.
That was a long way. Sorry.
It's incredible. And you've truncated it so much, because I've had the benefit of hearing the expanded version of both more insights in yourself and also the evolution and the development of NeuroFlow. I think interesting that here we sit today, in a post-pandemic environment, where there was a lot of acceleration of the virtual care model, and there's a lot of data coming out that it continues to be very effective in reaching people who have untreated, unaddressed behavioral health needs.
Right.
To think 7 years ago, I feel like that's sort of the way the universe sort of unfolds, right? As you start to pull on your own experience to create something incredible. And I'd love to dive into this sort of the origin of kind of how NeuroFlow started and maybe more population specific, right. With military veterans and combat veterans specifically, and then sort of move into how it's evolved, because it's inclusive, not exclusive, right? And that was part of your thinking and your team's thinking and design.
Well, that's right.
And since we really try to address social stigma through these conversations as much as we do, understanding what inclusive treatment and recovery looks like, specifically with addiction and substance use disorder. But now we know the substance use disorder and mental health are no longer, from the data anyway, exclusive from one another, right?
No, of course not.
It's more likely that you're going to have both than one
right.
or the other.
That's right.
So going back to my question, I want our listeners to hear more about sort of the origin and, take us there and then walk us through how much of your world has been able to reach into other communities and other populations. Because this is not the beauty of virtual care like this is that it can reach many communities.
That's right. And
many people.
That's right. And I think break down the barriers that previously existed to access to this care. Now, so my founding story, my personal why is connected to the military and veterans. But if you really think about it, and this is what I learned in business school, is that this is not just a military veteran thing, right? People talk about the 22 soldiers a day that complete suicide. People talk about PTSD all the time. But this isn't just a military veteran condition. I mean, if every listener here is being honest with themselves, if they haven't struggled at some point, and it's middle of March in Philadelphia right now, and their seasonal depression is real, for me too, that like everybody is impacted by it. They have loved ones that are, or family members, or coworkers and so forth. So this is a human issue. And interesting for us is that even though my first impetus was the military connection, our first customers were not in the military. And it turns out that the military is just this big bureaucratic organization that it takes a little bit to get into. So we had to prove our value and capability to be a resource in the civilian world. But today we get to go back. I mean, today we're supporting 15 million people across the country in all 50 states. And a good portion of them, about a third of our business, is with military, family of military, or veterans. We just were announced as a winner of the VA Suicide Prevention Award called Mission Daybreak. And, I pinch myself to think it's such an honor to get back and walk on those military bases as we're implementing the technology but now wearing civilian clothes, not my uniform, but get to go back to my roots, and it's pretty exciting.
That's incredible, and that must be an indescribable sort of feeling, right?
It is. It's neat.
Yeah,
it's humbling.
We've done some work with you and with your team at NeuroFlow. Because, like you were saying, this is a human issue. And a lot of our work here in our foundation is really rooted in the nursing profession, right?
Mm-hmm.
And we know that nurses were experiencing burnout. A lot of healthcare professionals experience burnout. And nurses, especially during the pandemic, had experienced burnout at record rates. And talking about, from military to frontline healthcare professionals, right, needing to be strong, needing to, there's almost a stigma placed upon them that you can't have issues, right?
Right.
You can't do your job well if you have these issues, but these are everyday human issues.
That's right.
That you don't want to leave untreated, right?
Mm-hmm.
I've admired the work that we've done with you all in the nursing space, because while other hospitals may have had the resources to create and to deliver the type of models for their healthcare worker population, not everybody had that.
Absolutely.
And you were willing to sort of go there with us. I don't know if that was new to you all, but that certainly was a newer space for us. And the results of that were incredible.
Phenomenal. And we still get to work with them, which is really exciting.
Which is awesome.
Well, I think so. To take a step back to understand what it is the technology at NeuroFlow is actually doing, and the easier way to describe that is to say what we're not. So we're not a telehealth company.
Right.
We're not providing therapy or psychiatry support. So we're not, with NeuroFlow, you don't talk directly to a doctor that's going to write you a prescription. There's a lot of companies out there that are doing really great work. There's also some not so great companies that are, being handled appropriately by the authorities and by payers. But the telehealth companies out there that are doing great work need to be accessed by the people. And so what our technology does is we run data analytics to help identify the people that need that extra level of support, and we'll help refer them to those therapists and psychiatrists. Now, if, again, depression or substance use occurs, it's not a binary decision or it's not a binary diagnosis. It's not like you have depression or you don't have depression. There's varying degrees of severity. Same thing with somebody that might drink too much or might struggle with substance use disorder with pain medicine, but not be using heroin or fentanyl or something like that. And so what we try to do is get people to the right level of care. And the technology provides self-service support tools to the lower severe people. So if maybe you just need some mindfulness or breathing exercises or reminders that it's going to be okay and you have these resources at your disposal. And by the way, if you need extra level support, here are your options. Before technology, it was really one option. If you wanted to see a therapist, you had to go make an appointment, you had to go see them in person, and think about all the barriers that presents. That's why people, if you're a nurse that's working a 12-hour shift and then when you leave, you have to go home and take care of your family. So when do you have time to take care of yourself? And I think that's where I get really excited with our partnership, because using technology, we like to call it a high-tech, high-touch approach. Mm-hmm. So people are definitely involved, right, the therapists that we partner with. But using a high-tech, high-touch approach, you can get the right people to the right level of care, whether that's self-service or with a person, at the right time. And the outcomes are profound. You see people that are happier, they miss less days at work, they feel more fulfilled, they're less of a risk of burning out, and ultimately I think it's better for the community overall.
I could not agree more. I'm going to go back to some of the things that you were saying, because as we're thinking about helping to better coordinate and increase access to those clinical pathways, mm-hmm. right? Whatever level they may be. We're really talking about this sort of recovery space.
That's right.
And I think a lot of people look at having an issue, solving an issue, but really recovery is similar to what you were saying. It's not linear, right? What is NeuroFlow? How does NeuroFlow work and operate in that space? So someone is goes to NeuroFlow, gets sort of assessed, right? Has the right level of either referral or tools available to them. Is there a cyclical process involved for them once they engage with NeuroFlow?
Yeah, so that's where first let's go to the assessment piece. So it's what are we using to assess people? And we're using clinical standards assessment tools. So there's the DAS-10, which is for drug use. There's the audit, which is for alcohol. There's an opioid use disorder assessment. There's a tobacco use assessment. All of these, in many cases, you may be given by your doctor when in the office and not even know it. Like if your doctor's ever asked you, Heather, how many drinks a week would you say you have? And you're like, I don't know, 2 or 3. Like that's actually a question on the audit. What we're able to do is collect those assessments and questions remotely and in a confidential, safe manner where the data is owned by you, the user. But what we do with that data is we say, okay, like based on that answer, like you might benefit from X, Y, or Z journey or a referral to the appropriate type of provider. That's not where it ends though, because we know that most people, we're in the IBC Foundation right now, so just looking at claims data, we know that about 2/3 of people that have a mental health or substance use disorder diagnosis never get it treated. Put that in a context, like think about if we said 2/3 of people that had a cancer diagnosis never got it treated, it would be a national emergency. And it's that same level of severity should exist with mental health, and I think we're, as a society, finally getting there. So the goal is to say, okay, those 2/3 of people, why aren't you going to get that support? And that's where the technology could come in and help say, well, you don't have to go see a psychiatrist. Like that's not, you're not at the level of severity where it needs medication. Here's another, maybe confidential, if you're worried about stigma or worried about the implications for your professional career, you can go get this other type of support in a technology discrete manner and get that care, ultimately improving your outcomes. And then following up with them to not only, like in my soldier's case, no one followed up to see was it improving. And if we could continue to collect those assessments on a longitudinal basis, you could say, okay, are things improving or not improving? If it's not improving, that's fine, but at least we know that so that we can make those adjustments. If you're not measuring it, you can't change it to improve it.
That's right. Yeah, that's right. And I think over time, so that, and I do love data. Data can tell a story. It's not the whole story, but it can tell a very important story, right? And as we're, and big data is great, but I think individualized data it can be even more compelling, because over time you can start to see patterns and trends emerge, and you see someone struggling more around the holidays, right? That's an opportunity for conversation, for intervention, for a reminder, as you said. And then there can be certainly more crisis level situations that you also all address. And I want to talk about some of those success stories, because I think it's important, just as we talk about recovery in the sense of addiction, that recovery is possible. We need to talk about it that way in sort of the mental health space as well.
Well, yeah, for sure. So the cool thing about using big data or data analytics too, and I just want to be sensitive about that, because a lot of people, especially today's day and age, are always worried about privacy and security, as they should be. But when you're dealing with the whole model that we've approached at NeuroFlow is we're a B2B company, which means the way that we make our money is by partnering with health systems, not by selling data or advertisements. And so that is important. It's an important distinction, because the same way when you go to a hospital, they have an electronic health record, that data is secured under HIPAA protections. So it's the same thing with NeuroFlow. So we're using big data, though, to understand what needs to occur with each person. And by the way, the profile of that person. So this is where it comes into like inclusive design, right? If I'm a military veteran, I'm going to have a different experience in the technology than if I'm a 30-year-old pregnant woman. We have OBGYN tracks. We have, versus if, by the way, if you're a 16-year-old high school student versus if you're a 70-year-old, retiree. All of those people will have different experiences that are customed for them and for the population. And so when we worked with like the IBC Foundation and the nurses, we were able to actually put in videos that were unique to those nurses in that health system, so it felt like the tool was for them. It wasn't just some generic app that they could download and access and that sort of thing. And when you do that, you see really incredible engagement, because people are, one of my product designers calls it the Netflix for mental health. It's like Netflix, I go in, it recommends me videos that I want to watch. It's the same thing with the tool.
I'm obsessed with that technology, artificial intelligence and the learning model. And of course, we're in the healthcare industry collectively here, but I think there's a lot of good that can be done and is being done clearly with that technology. And
For sure.
You broke it down in a way that I know I appreciate, and I hope our listeners will appreciate too. We know the stigma exists. I want to get into that a little bit because the data is, compelling, right? Whether you're talking about addiction or whether you're talking about mental health or whether you're talking about addiction and mental health, the data is compelling. So it just begs the question, you raised earlier, when we get to a point as a society where we know that people they're struggling or worse, right? But not seeking or not following through to get help. Brave enough to say they know they need help.
But then not follow through with it.
Not follow through
That's
with
right.
it. How much of that is driven by stigma, do you think, in your opinion?
It's a good question. In the cases where people don't follow up with care, I don't know if we'll ever really know the answer at a broad population health level. I think the answer is it really depends, especially when it ends in tragedy like suicide or an overdose or something like that. Like, we won't. Why did my soldier never go? Why does anybody that succumbs to their depression or substance use not get the support that's made available to them? And so I think it depends, but I think stigma in the military case, where like you have this sort of masculine environment of like you have to be brave, or first responders, where nurses are expected to take care of people, not be taken care of. I think it's more prevalent. And I think the way that you break that stigma down is, one, start talking about it. Mm-hmm. Two, provide different alternatives to access to care, which is where I think technology can play. And then help educate and inform. And so the technology, for example, one, we've gamified it. So you actually go in, earn points that then could be redeemed for gift cards. So stigma aside, you're like, you know what, I want a gift card. So I'm going to use this because I want a $5. Who doesn't want a $5 Starbucks card a week? All right. So yeah, I'll answer a few questions. But now I have you in there. And so now we kind of have the user hooked, for lack of a better term, and we can have them, okay, now let's give them a video to explain to them what depression is. And we could almost demystify it for them and be like, oh, wait, I'm not the only person that does this. What, 1 in 4 people do? That means in this room that we're sitting in right now with the producers and directors, we have statistically 2 to 3 people in this room have some level of anxiety or depression in the course of their life. Now, it's not something to be ashamed of.
Right.
And the way that you do that, though, is you have to start removing the barriers to access to that information.
Yeah, I think the what you present as incentive, right? Mm-hmm. I think is it's really smart, and I think that if you choose to use the word incentive or if you choose the word engagement, I think that it's important to know how to reach people, right? Once you can reach them in a way that they want to be reached, then it's almost like the possibilities are limitless.
That's right.
And so, yeah, maybe it is that day that it's just the goal of a $5 Starbucks gift card, or La Colombe if you're like me. But it says something about their willingness, right? There's a willingness there.
That's right.
And if I've learned anything about our work and your work and others' work in this space, that's the moment, right? And that's the moment where things can change.
Well, I think that people that are depressed or anxious or struggle with addiction or substance use to some degree don't like it. Like don't want to feel that way.
No, yeah, want to feel happy and fulfilled and
absolutely,
right?
They want to get better.
Absolutely. I've never met anyone that said I'd like to stay not well.
Absolutely. And so but when you're in that state of mind, and again, I'm not a therapist or psychiatrist. I'm almost speaking from the patient example, and I'm fortunate to get to work with a lot of therapists and psychiatrists at NeuroFlow. And, what we know and what I've learned is when you're in that state of mind, it's almost like this barrier to even, you want to get help, but you don't know how to overcome that initial inertia. And so giving them different tools and avenues to do that can help them find their path. And I think that's, again, technology is not the panacea, but treating it like a tool like anything else, when used appropriately, can be really powerful.
I totally agree. And also that there's not a shortage of populations that can benefit.
Everybody. I mean,
everybody, me, you, everybody, right? And we may come from different experiences and backgrounds, but like you were saying, it is a human issue at the beginning and the end of the day. And you're right, having that comfort and that willingness and the tool sets people on a different path sometimes.
And the impact to society, I don't think, can be understated or overstated. Yes, overstated. Can't be overstated. Right. In the sense that, one, these things are all connected. And by the way, physical medicine too. Like we don't say like mental health and physical health it's just health. When someone has diabetes, they're statistically more likely to have depression, and that depression impacts the A1C levels in their diabetes and vice versa. And so think about if you're in chronic pain every day. Yeah. You're in chronic pain every day, you're waking up, so you're depressed. I'm depressed, so I'm going to take more medication. So that's going to increase my risk of substance use disorder, and that my pain's not going to get better, so now I'm more depressed, and it's just this negative cycle. And so if you could improve the overall health, the substance use and the mental health, in addition to the physical health, you improve your overall outcomes, your overall happiness, you reduce the ER visits, it's better from a cost perspective. It's just in the healthcare world, we call this the quadruple aim. Mm-hmm. I mean, it's the win, 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 win.
Mm-hmm. Yeah, everybody wins in that
That's
scenario.
Right.
Yeah. So earlier in this season, we had the distinct privilege and pleasure of talking to the former U.S. Surgeon General, Dr. Jerome Adams, who I've not yet met someone in public service who has been more committed to addressing stigma mm-hmm. of both substance use disorder and, quite frankly, mental health. And incredibly passionate, and he spoke a lot about integrating mental health services into recovery support services.
Right.
We have a lot of integration that we talk about all the time. Traditionally, it's integrating some type of behavioral health into primary care, or primary care into behavioral health. This is a little bit of a different take on that. Let's talk about what NeuroFlow is doing in that space and why it matters.
It matters because they're not, again, it goes back to the idea that it's not mental health and physical health and substance use disorder. It's just health overall. And when you're struggling with addiction or craving because of a substance use issue, it's natural to have feelings of shame or embarrassment, to be anxious, to feel down and depressed. And of course, those feelings exacerbate the substance use issues. And so unless you get therapy principles of like cognitive behavioral therapy, teaches us skills and principles on how to reframe challenges and so forth. No different with substance use issues and getting a hold of that. And the challenge with cognitive behavioral therapy, despite its evidence-based to help with substance use and recovery and so forth, is the same challenge of like going to the gym. It's sticking with it, and it's practicing, and it's learning a new skill. And so what NeuroFlow has built in, and we've partnered with a bunch of, again, we're not the treatment provider here, but we've integrated evidence-based protocols through health system partners of ours that enable those skill builders, those cognitive behavioral therapy tools to be more engaging, so that someone going through recovery can follow a path through a digital means, can be reminded automatically. You're not needing a person to have to call them to remind them to do it, and then making those tools stickier for them so that they could follow up and basically, I mean, it might sound corny, but teach a person how to fish, not give them a fish. And so it's you're not just giving them a pill to say this will fix you. It might take medication too, but you're also saying, I'm going to give you the skills so that when you leave here, your therapy office, your doctor's office, you'll have the skills and the tools to be able to take care of yourself and ultimately be self-sufficient moving forward. I have a personal friend from the military that dealt with, one of the smartest guys I know that dealt with substance use issues of addiction. He hit rock bottom, and he's one of my heroes. He started his own recovery center because he saw what it did for him, and now he's helping a lot of people in his own who came from the same place that he was in. And so to be able to give people the tools to meet them where they're at, because not everybody has the means or access to get to someplace like that, is both rewarding, but also evidence-based to show that, wait, this actually works when done appropriately.
Yeah, that's incredible. Anything else you want to add, Chris, to today's conversation?
Maybe I'll leave you with this. 15 million people we're really proud to support. There's over 300 million people in this country, and every single one of them may not be diagnosed with mental health issues, but every single one has their days that it's rainy, it's cold, you're like, I'd rather not go to work today. And that's normal. And know that there are resources out there for you, and know that you have friends and family and loved ones, and you need to talk to each other and reach out to them and offer a helping hand, because the only way we get through this is together. So thanks again for having me.
It's incredible. Thanks for being here. Thanks for making the time.
Of course.
If you or someone you know is suffering from opioid addiction, please visit ibxfoundation.org/SYK. The link is in our show notes below.